Okay, so ladies and gentlemen, I hope you hear me now. I'm happy to welcome you to the session 2 of Data 2025, the use of data for healthcare and pandemics. My name is Olivier Crochat, and I'm the Executive Director of the Center for Digital Trust at EPFL. It is an understatement to say that the COVID-19 crisis has had an impact on our lives and societies. Everybody is paying close attention to all the numbers and figures that are given to us daily on the topic. And all of a sudden, most of us became real expert or seasoned statisticians, prone to challenge the numbers, the processes, critique the approximation and contradictions. So we will consider now what the role that data had played in helping to address the pandemic with 3 professors. So definitely an interesting topic. And the session will start with a presentation by each of our panelists. And then we should have plenty of time for Q&A session at the end. First, Professor Salathé will talk about data in epidemiology. Then Professor Troncoso will share her experience on data for contract tracing. And finally, Professor Hubaux will explain how we could achieve privacy-conscious health data sharing. At any point in time, feel free to ask questions using the Q&A button or the comments at the bottom of your Zoom window. We will gather all of them and, if time permits, answer most during the session later on. Let us start with Professor Salathé. Marcel is the head of the Digital Epidemiology Lab and an associated professor at EPFL, a position he has held since 2015. He holds a PhD in biology and environmental science from ETH Zurich. He founded and is co-organizer of the Applied Machine Learning Days. In 2018, he was elected as one of the 100 digital shaper in Switzerland by Bilanz and Digital Switzerland. As a digital epidemiologist, he works at the interface of population biology, computational sciences, and social sciences. Professor Salathé is a member of the Swiss National COVID-19 Task Force, and last week he was nominated to head the steering committee for Switzerland National Research Program on COVID-19. Marcel, we're all ears.
All right, thank you. I hope you can hear me, and I will now go to my slides. So if this all looks good, then you should see someone holding up an earlier version of Swiss COVID. Yep, good. Okay, so thanks very much for the invitation. Very happy to be here and to talk about data and epidemiology, something that as a digital epidemiologist probably describes my work in 2 words, data and epidemiology. And so it's been a really interesting year, to put it mildly. In some sense, I don't think we need to talk much about the epidemiology, and that's not the purpose of this conference. But it's nevertheless been an extremely interesting year for many perspectives when it comes to data and epidemiology. You all know this sort of hashtag or abbreviation TIL, Today I Learned. I think this year for me, there were a lot of TYIL moments. This year I learned. And many things there are not quite as I expected them to be. So when it comes to data and epidemiology, right, there was a certain narrative and still is, and then there's a certain reality that we've now sort of discovered this year. The narrative goes roughly along this line where, you know, we have all this data and then let's collect more data. Then we have big data. And once we have big data, of course, we can do machine learning and AI, and then we all win. And that's sort of been the narrative along which a lot of conversations in the past years happened. And I don't I mean, I say this slightly, with a smiley emoji here, in the sense of course, this is actually, it could actually be a correct interpretation of what's happening one day, but the reality, nevertheless, is has been quite sobering this year, right? So, I mean, big data, like, how about we have some basic data to even understand what's going on, right? If this has taught us anything about data this year, it's that we're actually in a data crisis. We seem to be, for some reason, everybody seems to be saying we're drowning in data, and data is the new thing, and oh my God, all this data. My experience has been the complete opposite. I didn't have enough data, and I wasn't even asking for big data. I was just asking for some simple data about the current situation of the pandemic, or the current health of our healthcare systems, or the certain KPIs to see whether testing and contact tracing works. Just simple data, and it's not there. So I'm a bit disillusioned at the moment with the idea of big data being very helpful in a crisis, but that's that's fine. The other thing is, when it comes to machine learning, yeah, that would be good once we have the data. I mean, here also, my learning this year was that we still need to work a lot on the human learning aspect of all of this. We haven't really been able to take the very little data that we have and really adjust our priorities correspondingly and our actions correspondingly to really deal with this pandemic. And that has to do with all kinds of issues that we won't have time to go into here. But I'm puzzled by how much there we still have to learn about how we ourselves function, and just how much we could do to improve the situation before we even go to the stage of big data and machine learning. So normally, right, when I give talks and lectures about the digital epidemiology approach, which I'm going to hold extremely short here, is I show a few slides of past studies that have just shown just how wonderful it is when we actually have data and can sort of explain certain patterns. And these are some examples I show. I show, for example, disease outbreaks in Senegal, cholera outbreaks where there was not a clear understanding about what was going on in terms of these epidemic curves, these enormous peaks, right? These are not even waves, these are huge peaks. And then eventually, mobile phone data was able to sort of highlight exactly what was going on. It's a good example of mobile phone data being able to help us assess an epidemiological development. Something else I showed was, creative use of Wikipedia access logs to track infectious disease outbreaks, like the seasonal flu, of course, always an interesting example. And then a third case, and this was actually the beginning of my own digital epidemiology adventure during the last pandemic, which was in 2009, the H1N1, where we sort of started digging into Twitter as a tool to understand what is the public discussion about vaccine. And I'm not going to go into detail, but spoiler alert, people thinking Bill Gates will inject chips into your blood, it's not a 2020 idea, okay? It was already there in 2009. So I think we can all calm down a little bit when we think about the vaccine infodemic. I don't think it's anywhere as bad as people sometimes make it to be. But so these were the sort of early examples. Now, some of that is still here, right? I mean, to give you an insight into my own work, I mean, of course, we've been mining Twitter data like crazy since the beginning of 2020, when we saw that this was starting to happen. One of the things that we were looking at is, in particular, also like who is actually getting heard on Twitter, because people are realizing, and by people I mean mostly politicians and public health officials and so on, that yes, Twitter is not just a bunch of random people, although it does sometimes feel like that, but it's actually really a good indicator of what is going on and what are sort of driving dynamics in a global conversation. And what we saw, for example, here when we analyzed this data, this is hundreds of millions of tweets, is that initially the conversation was actually quite strongly, I wouldn't say dominated, but led by international experts, right? Mostly scientists. And for example, if you look here at panel C, this is what you see, right? This sort of attention per user and attention measured as in interactions and retweets and so on. But then very quickly, this was overtaken by political conversations. And this, everybody sort of knows, yeah, the pandemic got politicized. This is the data to actually highlight this a little bit. And of course, one can go into many more examples and details here, but just to say, right, this big data approach certainly is still extremely interesting, and we continue to do it. There's been recent papers that were published on mobile phone usage in the USA to sort of figure out what is going on. And that's also, I think, of interest, but it's coming at a time point when essentially it is interesting, but it doesn't have a direct impact anymore. The way where we worked on and where I also was involved a little bit in Switzerland and then also abroad actually was a very data poor solution by design. And I'm sure we'll hear more about that, which is this digital proximity tracing based on a decentralized approach that eventually made it into the phones around the world, where we're now getting early evidence of it, that it's working. But where we also see that the uptake still need improvement. And 2 points that I maybe want to quickly talk about here is that this system, even though it's fascinating and very well thought out technology, it is hampered in 2 important ways, which is one, based the uptake issue, which is I think an issue of trust in governments, and the second is local processes around it, which is often which is not discussed often enough. So this is a screenshot from a press release or a press report and a study that just recently came out. This basically says, the number of people that have a contact tracing app installed, Switzerland, Germany, and Austria, and I think you can translate yeah and nein yourself. But there you can see Switzerland is actually not doing so badly. It says 46%. Now our activity data shows this is actually lower, but there in this particular survey, that's at least what people said. Which, in parentheses, that's also something I think I've learned this year, that I should really not trust put too much trust in surveys anymore. Because I think increasingly we're seeing evidence that in surveys, people are answering what they believe to be the correct answer rather than what they're actually doing. But this is maybe for another discussion. Going into the details a little bit, what were the reasons for not installing such an app? And you can see I translated here in black because, again, this is German. So the number 1 point was data protection issues, which is interesting because this is such a data-free app that it makes all your other apps look like complete surveillance apps. But still, the sense was this is a data issue, therefore I'm not downloading the app. Further down, you can also see fear of surveillance was also a high, and then issues like I don't care, which I find fascinating. We're in the middle of a pandemic, and the answer is I don't care, but these are things we have to take into account, right? Also on the processes side, where we're seeing that things are simply not working, because for this app to really, also for this technology to have its epidemiological effect, you eventually need to have processes around it that work as well. And one of them is, of course, you need to get tested. You need to get tested rapidly. And when you get tested positively, you need to be able to confirm to your app in the form of a code, COVID code, that you're actually indeed got tested positively and you're not just having, a sore throat or something that's due to another virus. So we, again, we have practically zero data on how well these processes are working. I'm not even asking for big data, just some KPIs. One that we finally managed to get is this. This shows you distribution of the days between onset of symptoms and then entering of the COVID code. So again, right, there can be multiple steps. You have to get a test. You have to get the test results. You have to get the code. So multiple things, multiple processes have to be in place. And you can see, for example, just a few days ago, this took, in half of the cases, this took over 5 days. And after 5 days, the epidemiological effect that this app can actually have starts to collapse fairly rapidly. Now, I have to say this is improving now a little bit. I think, also because the alarm has really been raised that, doing contact tracing and doing testing is not sufficient. You have to do it fast. Otherwise, there's no epidemiological effect. But still, it shows us, right, that the processes around it are not well implemented, and that's a real issue. The analogy I use here, which maybe makes people understand this a little better, is imagine you develop a vaccine, which is sort of cutting edge technology. You can show it works, but then you let it essentially spoil in the field, right? You let the vaccine container stand around for a couple of days, at room temperature or outside temperature, and the vaccine, stops working. I mean, this would be unacceptable to any of us, right? If such incompetence would show itself. But when it comes to digital processes, we seem to be somehow accepting that. So we have to be clear, right? We can develop strong technology, but it must be integrated in a process that is also strong, because otherwise, if there are weak links in that process, the most cutting edge technology is not going to work. And this is something we're really seeing now with apps like Swiss COVID. Again, if we would do the same thing with a vaccine, people would be absolutely befuddled. And yet here it's somehow, well, it's just a little bit what it is. We can't be faster. This is strange to me. That doesn't mean we should stop doing this. I think the alternative, some of us who've been on the team sort of pushing this technology have seen our fair share of the alternative universe, which would not be not another technology, but which is a real danger of the rampant spread of bad technology, where people would just say, well, I have a tool, let's just collect all the data that we can, and then somehow, right, this will help fight this pandemic. So we must continue to be vigilant with respect to the technology development. In maybe the last 5 minutes, I just quickly want to give you an update on where we are with this. We started with this proximity tracing app. These are all the exposure notification apps that are now out there. This in Switzerland, this was Swiss COVID. Now there's this notion that we should also do presence tracing. I personally would like to also see that in Swiss COVID. The way it works is it has slightly different epidemiological concepts, right? Proximity tracing, you're really asking who was close by, and then you can sort of forward trace people. For presence tracing, where you ask at which event were you, and along with that question, not only to ask, who could you have infected, but where could you have been infected in the past? This allows you to identify clusters. So, concepts of forward tracing and backwards tracing, where you want to understand where did you actually get infected, because we now know that many people get infected at the same place at these cluster or super spreader events. The corresponding decentralized technical proposals for the protocols were DP3T for the proximity tracing, and now presence tracing is crowd notifier. All of this information is online, and maybe my following speakers will talk a little bit about that. In the case of DP3T, we couldn't just implement that directly into phone because it required the hardware, Bluetooth in this particular case. And thus, we were dependent on Apple and Google doing the right thing. They then implemented the exposure notification protocol, which is largely based on the DP3T protocol. But for crowd notifier, we're not in that dependency. Anyone could just implement it. And indeed, there are demo apps already out there. They eventually then made it into, at least the proximity tracing made it into Swiss COVID, and I would like to see the presence tracing also be part of Swiss COVID. There's a, as I mentioned, there's a demo application out there called Notify Me that you can also look up and install. Again, it's decentralized and privacy preserving. The data stays on the phone unless it's needed. And so you don't just collect this massive amount of data from everyone before you actually need it. And even then, of course, you're extremely careful what sort of data under what circumstances you actually will get. And all of this, of course, always on a voluntary basis. So this is the sort of diary that people are now also talking about. But the idea is more than just keeping a diary so that you can have a contact tracing conversation with a contact tracer. It's really about you having events, even private events, where you can generate QR codes, one that you keep private and one that you publish for the people who come to your event, so that if someone comes to your event, they can then check in. Eventually they can check out, right? Say I was there for 30 minutes or set reminders and so on, and then you have a diary on your phone. But again, this is all decentralized, stays on your phone. And then one day, when this event is for some reason identified as a potential problematic transmission event, you can then activate this other QR code, and then everybody who was at the event present, because they scanned the QR code, can then get notified. So similar, right, in spirit, like the proximity tracing app, except now it's not because you were close by someone, but it's because you were at the same event. And this can really help identify clusters, because Swiss COVID, right, already has this system where we know this person is infected because they got a COVID code that they entered into the phone. And so now this is a confirmed case, and the information about where this person was at which events can then be used to identify clusters if multiple people all of a sudden pop up in the system that were at the same event. And it's been shown over many times now that this can improve your contact tracing by a factor 2 to 3, which is huge, right, in terms of efficacy of contact tracing. Of course, all of that, again, requires that all your other processes before work well, the testing, the delivery of the codes, and so on. But at least we have a second shot here to make this even better. Again, the issue is forward tracing and backwards tracing, because you can identify problematic events, and then you can do, for example, testing on everyone who was, for example, at a given club that's now been identified as problematic, or a certain event. And then you can do forward tracing from these people. And so, like, by doing so, you can really do what is now called cluster busting, which is important because that's been shown to sort of be responsible for 80-ish% of all transmissions. Okay, my summary slide. This is maybe a particular crisis learning, but it's really not been about big data and machine learning this time. It's really been about having the relevant data in time and then adjust our behaviors and our strategies according to it. So what I would call human learning. And I think on both of these points, I think in Switzerland, we have a lot of work ahead of us because the way it's worked has not been optimal. And I think there we have some, yeah, our work cut out for us for the future. I wouldn't throw out the baby with the bathwater here, and I'm certainly not willing to throw out big data and machine learning. I think this is essentially a gradient that increases over time as we go from crisis to normal. As more data will accumulate, it'll help us understand certain aspects about this crisis, and hopefully, you know, we may even get insights that were not available to us before that could then help us next time. But I think we need to be humble and say, okay, in the moment of a crisis, especially a fast-moving crisis, what we need to do better for next time is not to have better big data or better machine learning models. We need to have better processes. We need to be able to get simple data faster and then adjust more, you know, agile. And the third point that I would like to make is that I think what we've seen here is also a consequence of what's happened in the past 10, 15 years, which is a massive liability that's been created by this abuse of digital data in the past 10, 15 years, where essentially people have lost the trust in many such apps. They're still using, I guess, many sort of abusive apps when it comes to data and privacy, but probably because they get something in return. I mean, not probably, that's almost a given. And when you then present citizens with privacy preserving apps that are really helping fight a pandemic, they turn your back and say, no, thank you, right? I don't trust you. I think this will be used for surveillance. And so we have this massive liability that I'm not sure how we will get rid of. I think we maybe did a first start here in developing and rolling out this technology that cannot be abused in that way, and hopefully that will give us the necessary trust next time around. But this time, it obviously wasn't sufficient. Good. Thank you very much. That's it from my side. I'll stop sharing here.
Thank you very much, Marcel. It was quite interesting and clear, I think. We had a few questions on the issue and a lot on anonymity and dependency towards Apple and Google. We'll keep those for the discussion later on. I think you panelists can also see the question, the open one and the solved one. Solved means you have been passed to them, so we'll do that later. So I'm really looking forward to getting more information on why you have some data missing and how could we get the interesting data to you so that you can help us for this pandemic. So it's my pleasure now to introduce our next speaker, Professor Troncoso. Carmela is an assistant professor at EPFL, where she heads the Security and Privacy Engineering Lab. She holds a master's degree in telecommunication engineering from the University of Vigo and a PhD in engineering from the KU Leuven. Before arriving at EPFL, she was a faculty member at the IMDEA Software Institute in Spain for 2 years. And then during 4 years, the security and privacy technical lead at Gradient, working closely with the industry to deliver secure and privacy-friendly solutions. She received the Best PhD thesis awards by the European Research Consortium for Informatics and Mathematics, Security and Trust Management. And during 2020, she led the DP3T effort working on privacy-preserving solutions to support strategies to mitigate the COVID-19 pandemic. So Carmela, please share your screen and experience on developing a contract tracing app. Thank you.
Thank you, Olivier. Let me share my screen, which hopefully now you can see. Very cool. Thank you very much for this invitation. I'm going to try to explain a bit more why and how we build this app and the context of this is a little bit of a lot of the things that Marcel has said, and it's really about how new technologies can help. And it is typically believed that new technologies are more data technologies, and how can we use technology to take data better. But this is actually not the case. And one, I think, of my this year I learned, which I will steal from Marcel, is that data that was promised to us as the solution for the last 10 years, both from the private sphere, private industry sphere, the political sphere, about we need to have better programs to know how to do better data-driven systems. Actually, when it came to the pandemic, was not really something very helpful. As Marcel said, getting the correct data, which doesn't need to be big, just needs to be the adequate data to answer the questions we have, is very hard. Previous data do not help because the world has changed. It's now upside down, so nothing that we had before. Similar to what we do now, we cannot really assess if any of the data we get, like for big data used by big companies that actually may have data like these, like the Facebooks and the Googles of the world, they're making conclusions that we don't know if they're right or not, because we don't have any way of testing this thing. We just go directly to draw conclusions. But actually, the kind of technologies that really helped in this pandemic are systems-based technologies. Things like today we're having this event on Zoom that allowed us to kind of keep a lot of our both business relations and human relations, like family relationship. And I can talk a lot of this as a person that lives in a country that is not my country, and I can only see my family now in a little box. But also other type of technologies that people use to survive confinements, like streamings, like shopping online. There was a lot of systems in there, and not so much about data or data that is about humans. There was a lot of data about systems. Of course, we need to scale them and do these kind of things. But kind of all of these big hypes that we had in the beginning, or like prior to the beginning of the pandemic, seems kind of not having been the thing that actually we need. But what we need is that when we build systems, and I'm talking about system and infrastructure, we do them in such a way that we don't undermine all kind of relations of power and democratic values. And this was my experience with contact tracing apps. And the context of how I arrived here to this problem is that technologists were called to help with pandemic contention. We knew that pandemics, one of the best tools that we have to stop them is what is called contact tracing, in which we try to stop chains of infections. One of the big problems with COVID-19 and previous pandemics is that if you just let people go around, the number of cases grows very, very fast, and then we're just not able to contain it anymore. And this idea of tracing, where you would identify people and call them and ask them to please be careful, go home, get tested, was basic to ensure that those numbers never get too high. But what happened with COVID-19 is that the number of cases were much larger than what the contact traces of the world that were thought for previous diseases with this kind of big spreads like Ebola or like AIDS were able to absorb. They were soon overwhelmed. They couldn't handle all of these cases. They could not call people. And actually, I'll go back to the end of the conversation. We're back in this kind of case where the contact tracing infrastructure has collapsed again. So the need here is a complement to this manual tracing strategy. We need to be able to tell people that they are at risk of creating more contagions, and we need them to be careful so that we don't overwhelm the health system and we can actually save lives and keep our social lives, or keep this under control. And when I'm saying this is very basic, because the first time I was posed with this problem, like people need to, we need to do contact tracing. The traditional way of thinking about how we digitalize is we take the problem that we have in the offline world and we digitalize it. It means we take each of the steps that we have in the offline world and we just create a digital version of it. But it turns out that when you go to technology, sometimes you can do things that you cannot do on your offline processes. And that means that when we think about systems and when you think about systems from a private engineering perspective, we don't think about the traditional process and what it did and try to digitalize it step by step. We think about what the traditional process was trying to accomplish, and we see what is the best way that we can do this in technology so that we can address the drawbacks or the parts where the original process is weak. And that is why we're introducing a technology. And the weak parts of the traditional process were basically that it was slow, because as the number of cases came in, it was not possible anymore to talk to people, do interviews, gain information about who are they, who are their contacts and how to call them. Sufficiency, because doing this with humans takes a lot of time. We need to do all of these interviews, then we need to pick up the phone and call of these people. If they don't pick up, you need to remember and call them again. And it's scalable. We're talking about thousands and tens of thousands of cases, like we lived in October in Switzerland. But the truth is that all of these things, that a lot of them are associated to the fact that we have to first identify people and then call them, are not really core to the goal of the system. The goal of the system is not to identify these people and to call them. The goal is to have them knowing that they have been close and they are at the risk of being infected. So the very goal is to notify. And that means that that is the kind of thing that we need to focus on, how we notify. And at that point, technology indeed can help. It can help complementing the manual tracing scheme, in particular when the manual tracing scheme collapses, it's not able to handle these interviews and calls anymore. And we at least have a barrier of contention that help us to find some of these cases. And because we're putting technology in, technology is powerful. Technology allows us to collect new intelligence. Technology introduces new flows of information that do not happen when we are in the offline world. And as such, every time we introduce a technology, and in particular when we introduce a technology that we're gonna ask all of the citizens of a country, all of the citizens of a continent, all of the citizens of the world to put in their pockets, it's extremely important that we try to do this without introducing new problems. We cannot solve a problem with technology and then leave another one, which is one of the things that happens with many of the technologies that are now recklessly just being spread around the world. So the idea that we had is that when we put the system in place, this system must be only used for one and only purpose, which is to notify users about them putting at risk other people because they may be infected. And we didn't want to have any other information in this system that could be misused for surveillance, misused for manipulation of society by knowing how people interact with each other and take decisions that were not particularly to contain in the pandemic, but maybe enable other type of technologies. And from previous abuses, like this thing is not new. Apparently Bill Gates was not new in 2020, it was in 2009. The fact that government intelligence agencies use information as social relationships and location to actually surveil and manipulate people. It's not from 2009, I'm sorry, it's much, much older concept. So we already know that, and we try to build a system that hides all of that information that could at some point be used for a purpose different than contact tracing. And that could be the identity of the users, their location, because we know that locations reveal a lot about people, like which kind of religious buildings they use, what is their job, what are the kind of entertainment activities with the kind of things they like. Do they go to political events? Do they go to other type of events? And also behavior in terms of social behavior, who they talk to, how often, and for how long, can say a lot about what these people do, and is the kind of information that can be used for many other things that we didn't want to enable, while asking people to install something to save to save lives in the pandemic. And of course, together with this, it's not that the misuse the misuse is the most important in the sense that it does not introduce new problems, but we also need the system to work correctly. That means that makes the production of false alarms as hard as possible and avoids denial of service, because if we introduce a technology, but then the system does not work, we have actually not done any good. And in this, we produced the protocol that nowadays is the basis of SwissCovid. And for those of you that don't know how it works, the protocol works that when you install the app on your phone, the app produces a key. The key produces a series of random numbers. With this series of random numbers, what we mean by random is that these numbers are not connected to this key. And if you see two of these numbers, you cannot know that they are connected to each other. The fact that every phone produces different random numbers is so that this random number cannot become an identifier, a pseudonym for the user, and the users cannot be tracked. And then when the users go walking around and they are broadcasting these random numbers, if another user is close by, then the other user's phone would pick this random number and would store it with a little bit of information about the power of the signal, which serves as information to know how far it was. You can think about this power of a signal like the volume of the voice. If I go far away, you're gonna hear me more muffled. If I come very, very close, you're gonna hear me louder. So power of the signal is kind of the same thing. If you're too far, then you will not hear anything and your phone will not record this information. If at some point one of these users had bad luck, let's imagine that this user A of actually having COVID-19, they will ask the doctor for a code. And with this code, they can release information that will serve to notify us. And the key choice of our protocol is that if this information that is released are the codes that the phone of this person has produced. Why those codes? Because those codes do not encode any information about the identity of the person. They are only related to this random key that the phone created the first time that you install the app. They are not related to the location, where and when a person was, because these random numbers are created upon a predefined schedule and they don't really care about your movements. And they hold no information about others because you always have the same numbers, independently of how many people you have met, how often, and for how long. So those are the information that we put in the code. And this is how we ensure that the information that leaves the phone is not available for abuse. This information in and of itself does not allow us to reveal any more information about users, their behavior, and all of the things that we were worried in the beginning. And then other users go to the server, they can download these random codes, and then they can check on their phone, have I seen a random code? And for all of the random codes that they have actually seen, then they use this other information, remember that they said about power, to make a computation with all of this information together and decide whether the exposure to those people that have the virus had been prolonged enough and close enough so that they are at risk. In that case, the app will show a notification that says you have been exposed. And in the case of Switzerland, it asks people to call an info line where they will go through more questions and then take a decision as to what is the best path of them to take a test, to go into quarantine, or to maybe not do anything. And the system was thought to sunset by design in the sense that even if the system is in place and the Swiss COVID app is on the App Store for longer than the pandemic, as long as people don't use them, as long as people uninstall them and they do not upload codes here anymore, then there is nothing in the system that can happen. And these good properties of the system, the way that it was by design thought to not be invasive and to try to prevent abuse and limit the purpose of the application that is generated, is what led Google and Apple to take our protocol and on it base themselves to create the exposure notification that is nowadays the basis of contact tracing apps in the world. But soon, as very well Marcel pointed out before, we discovered that designing the protocol, this crypto part that we could do in academia, was actually a very small piece in the puzzle to make these kind of applications work. And this for that, the EP3T team actually was a huge team during summer, more than 30 researchers from 10 different countries, because we went around and find experts that could help us make the rest of the piece of the puzzles. We know that the protocol now has to be integrated in an app that lives in an operative system that has particular limitations. And then it has to be integrated in a bigger health system, all of these processes that Marcel was telling about. While we are kind of careful with societal impact and law, and we're also careful of actually being fulfilled the epidemiological type of needs that we have, because if we build a lot of this stuff and then it doesn't do any epidemiologically good, why on earth did we spend all our summer working for nothing? And that's where the team is very broad, and it's not only about privacy, but we had people on systems that would help us hook up with cloud and with systems, a lot of crypto, people on wireless security to help us deal with the problems that come associated with the fact that we're using Bluetooth technology, a lot of requirements, engineering to really understand what is needed and how can we minimize the data, and a lot of interdisciplinary work, as I said, with epidemiologists. Marcel was one of them. We had others helping us, as well as ethicists and experts on law, to make sure that the final product that we were building actually was deployable in real life. And this thing about the protocol, when we started with, we're going to be respectful. Again, little did we know, as good academics that we are living in our ivory tower, that just building a protocol is not enough. As I said, the protocol gets integrated in an app, in a mobile phone, in a bigger health system. And it turns out that all of these other pieces in which we put our piece in the middle also create new constraints and new difficulties to be able to uplift the privacy properties that we have from the protocol to an end-to-end system. In particular, we got many constraints from the fact that in the end, we did not implement the protocol. It was Google and Apple on the response notification, and they took decisions about how they thought the system should work. But they only think about mostly about the mobile. They didn't think very much about how all of this connection would work beyond that. And that meant that we need to make changes in our design, not on the protocol, but on how the phone communicates with the server and so forth, so that we were able to ensure that all of the things that we promised that this app would do were actually made in reality. We also had system changes, like, for instance, if you have Swiss COVID, you would have seen that about a month ago, Swiss COVID also includes some other information about the pandemic to just help people be informed. And we needed to make sure that this information that we have to download from somewhere does, again, not interrupt or not interact with the privacy properties that we have for the people that are using Swiss COVID. Other things that we had to do, one of the key privacy problems is that when I discovered this very nice cycle of how Swiss COVID works, I said, if you're sick, you upload your random numbers to the server. When you upload this random number to the servers, you are, if the only people that do that are people that actually are positive for COVID, that means that the very action of uploading would reveal something about your health. And we promised people we would actually protect their health status. How we solve that is by creating mechanisms that not only the people that upload the data, the COVID positive ones, but every phone does upload data from time to time. So that when you don't see an upload, you don't really know whether this upload was because you're positive or because the phone is just doing it out of the blue. There is a lot of technological development behind it and a lot of math to show that actually what we're saying is okay. But what I want to say here is that when we designed our first mechanism, little did we know that Google and Apple were going to make some things on the protocol that would make our mechanism hard. And there were also some of the things that we had in our cloud that we had not foreseen that would also make that hard as well. So since the beginning of our design and our big journey with the protocol and also helping with Swiss COVID, we had to redesign this upload process up to 4 times to make sure that the system works as intended. We also have other operations that we didn't foresee when thinking about the protocol, like the fact that because Swiss COVID wants to be very agile and be able to change over time, it downloads a configuration file that helps, for instance, to change the thresholds in the when we make decisions about Bluetooth signals. That retrieving this configuration could also be problematic because it could, if it was associated to tasks that were associated to health information. So we had to redesign that. We made a protocol to count active users because just downloading is not enough information. People can download and then uninstall or then switch off the app. We want to know how many people are active so that we really can have some estimation about how well the app is working in Switzerland. And we now have a mechanism to do that without knowing which apps, which persons, or where they are. And all of these other things that we have to build on top of our little protocol to make this happen. And the current status, and these are data from October, because at the end of October, with the hip of the wave, where we were to plus 10K cases, the system completely collapsed. So data from November is not really reliable because we don't have really good data about what is happening, which codes are being delivered and so forth. But in October, there were 1.88 million users. That's 22% of the Swiss population. And there were more than 50,000 users who uploaded their kits. That's 15% of the positives in Switzerland, which is a little bit worse than in previous months when we actually had these two percentages coinciding, telling us that the people that had the app were mostly actually fulfilling the case that they wanted to notify others and they were able to do it. And in the field, through surveys, not through data that we can get from the app, we also have evidence that the app does help. We have 185 positive cases that report the app in reasons for going to take a test. And in terms of speed, which remember is one of the key things where we are introducing technology to help alleviating the problems of the contact tracers that just cannot get, they don't have enough time to read cases and to call them, and we cannot increase the number of contact tracers in such a way that they would be able to do this very fast. We see that people that receive notifications from the app actually do that from half a day to 1 day faster than when they receive a call from the contact tracers. And in a particular cohort in Zurich, where we know that for a while the processes actually were working pretty well, meaning that all of the things that go around the app were working, people were getting codes, and also in Zurich we have a bigger penetration than this 22%. According to this survey, like people saying, do I have the app when they go to taking tests? We know that for every code that was uploaded, there were 22 infoline calls, and 5 of those were deemed risk enough to go into quarantine. And we know that from the people that were tested because of the app, there is 1 positive every 10 cases, which is kind of similar to the same rate that the manual tracing has. Which means that in cases where the rest of the system is actually working, it seems that the app does the job and is one more of the items that we have to contain the pandemic. And notice that they say one more, because if we hope that the app on itself is going to contain the pandemic, then we're going to have a very bad surprise. And just getting to the end of my talk, this protocol and this app is the first truly privacy by design product that is developed at large scale. And by truly, I mean one that really is based on the idea of purpose limitation and on collecting zero data, not on collecting data and use it in a privacy preserving way, but on just not collecting the data, because it turns out that the data is not always what we need in order to fulfill a purpose. These are the countries that have apps, and by now more states in the United States have actually developed apps based on the system. And these 6 here actually have concretely are based on the code that we developed here in Switzerland, and as such also have a lot of the other mechanisms that we design on top of the protocol to ensure the privacy of the users. And my key learnings, one of them is very similar to Marcel. is that technology by itself is nothing. Technology can be great. We can do the greatest protocol. We could have even chosen to get all of the data in the world. Given how right now the health processes work, the app could not have been a success. Just because if people don't get these COVID codes to upload, it doesn't matter if they upload codes or if they upload something else. These things are not going to work. And I'm sorry, but even if we had some kind of automated data collection everywhere, by now I have my doubts that the health authorities would actually have the capability, and not in Switzerland, like in the rest of the world, we're seeing this across the board, to really use this data in order to make decisions. So at that point, it's very important, again, that when we deploy things, we take thoughts about how much data we're going to need. Can we do it with less data? And especially, can we do it in such a way that we don't introduce new risks that may result worse than the actual problem that we're solving? And my second personal learning is that privacy engineering, which I have been done already for many years from the lab and in a small projects in very, very contained domains, when you actually work in a bigger project in which you have to deal with real practices of software engineering, like agile things with the surroundings of the system and what the system needs to do changes, like, as I said, this new, let's gonna have more data on the app to show to the users, or in a service world, where you depend on libraries that others program and that others may change without actually asking you, is exhausting. We had to be here redesigning, and we're still here making sure that all of the changes that happen to the app actually do not result in a detriment of the privacy properties that the people and the citizens were promised. And with this, I'm gonna end my presentation, and I'll be happy to answer questions.
Thank you very much, Carmela. I know privacy, personal data protection, and anonymization is key to your work and to your heart. So it's good. I love the puzzle image, and where in fact there is a challenge there in that you might be okay doing some specific pieces of the puzzle, but bringing everything together and ensuring it works and the whole process still keep the privacy preserving part is really it seems a real challenge. Thank you. So looking forward also hearing you later during the Q&A session. Our final presentation will be by Professor Hubaux on, I mentioned already, the data protection in personalized health, or privacy conscious health. Jean-Pierre is a full professor at EPFL, head of the Laboratory for Data Security and academic director of the Center for Digital Trust. He leads the data protection in personalized health project funded by the ETH Council, and is a co-chair of the data security work streams of the Global Alliance for Genomics and Health. From 2008 to 19, he was one of the 7 commissioners of the Swiss Federal Communication Commission. He's a fellow of both IEEE and ACM. He's also among the most cited researchers in privacy protection and in information security. Jean-Pierre, whenever you're ready, you are.
I think I am. Can you hear me?
Yes.
Very good. Okay. Hello, everyone, and thanks for having me here. And it's a pleasure to be at least virtually in this event. So I'm going to talk about privacy-conscious health data sharing, and in a way connect to what Richard Baldwin was saying at the beginning in the opening session about the need to break the silos in order to move forward. And also what Marcel said, don't throw out big data and machine learning. This is going to come back. So after the presentation also by Carmela, that where she insisted on solutions to be data thin, I'm going now to go back to the importance of making appropriate use of more substantial data. So here an example of medical question. How effective is hydroxychloroquine to treat patients affected by COVID-19? As you know, these are questions that came again and again over the spring. And so this is not an easy question to answer, because this is really repurposing a drug, and unfortunately it comes with the side effects, right? And what this story and many other stories have shown is that actually, in spite of all the wonderful technology we have nowadays in terms of information, information technology, internet, and so on, the pipelines on medical data are still really not at the level they should be. So in particular, there is a very simple notion of multi-site studies that are absolutely fundamental to move forward in the complex field of pandemic, but also to address other diseases. So the ability to make sense of data that are located in, for example, different hospitals, right? And from a purely database point of view, this seems to be completely trivial, but actually it is not. And I've been interacting and working and doing research in the field of protection of medical data for the 9 last years. And I can tell you the situation is really surprisingly unsatisfactory. And one of the reasons why we've been struggling so much with this pandemic is notably due to this situation. So, of course, if the data are located in different places, it means that one has to interface with several ethics committees and the IT services, different diverse legislations, the heterogeneity of the data semantics and of the data quality. And this is actually partially due to the reluctance to data transfer and this reluctance itself, right? Because if one entity transfers the data to another one, then it means losing control and losing a publication advantage, right? And so there's a widespread practice in the medical field that is so-called de-identification of the data. So removing the, let's say, obvious identifiers, which are, the name, the social security number, birth date, and so on, and hope that by doing so, the data is actually protected. And so the research usage of de-identified, let's say using de-identified data, so data that is just de-identified, requires usually patient consent, whereas if it is anonymized, which means that it is not possible to go back to the original identity, then the consent is not needed, right? And this is something where the ethics committees play a crucial role. What they do, they take as an input a study protocol and a consent form, and then based on the legislation, the ethics considerations and other considerations that they don't insist too much about, which is including institutional interests, they make a go no go decision and provide some feedback, right? This is what let's say researchers in let's say dealing with medical data face on a daily basis. And it's actually, unfortunately, a very slow, manpower-hungry and tedious process, and it requires to obtain the consent must be informed, unfortunately, diversity of consent forms. So it's quite a convoluted and complex and somewhat uselessly complex space. And the ethics committees essentially make an on-paper a priori evaluation, but they have little control on what happens afterwards. And the risk with this kind of thing is that there is a race to the bottom, which means that the researchers that are obtaining more permission are going to extract more value from the data and will gain a competitive advantage. So no one is really happy about the situation. The ethics committees do a great job. They do what they can with the current situation, but it's clearly something that is not, let's say, at par with the way the technology would make it possible things to work. Right. So let me now take the risk to throw a little bit of technical content to this diversified audience. So I have two relatively technical slides here. You tell me afterwards how much you enjoy this. So I have to throw in one concept, which is secure multi-party computation. The idea here that it is, because this is a fact that is usually not known, it is actually possible when having 5 players, each of them having some piece of data, to let the computation take place without having to centralize the data to any of the parties, nor to another party, right? In such a way that after the computation, there is a kind of exchange of information around them, but without sending the data. At the end, each of them is going to learn the output whatever this output is, let's say, so the input, we call it x1, x2, etc. And the output is going to be y1, y2, and so on, right? And so there's something that is a well-known fact in computer science, but that is unfortunately not enough advertised. It's the opposite of blockchain, that is a well-known fact in computer science, and is too much advertised, right? So it's quite intriguing. And the other technical notion I have to throw at this, to propose to this audience, is homomorphic encryption. Haha, what is this? So this is the fact that if you take two operands, it is, with homomorphic encryption, it is possible to make a computation of these two operands and then encrypt, or it is possible to encrypt separately the two operands and then make a computation. And if you go one way or the other way, you obtain the same result, right? This is not true in general with crypto, but if the crypto system is homomorphic, then it is actually possible to do such a thing, right? And this makes it possible to compute on the data without seeing the data. Well-known fact, has been around for 3 decades in, if not more, even more actually, in computer science. But now it is time to put these things in operation to respond to the challenges we are facing. Right? So we have developed a system that Martin Vetterli kindly referred to in his introductory talk this morning. This system is called MEDCO, that we have deployed at three university hospitals in Geneva, Lausanne, and Bern. With the intention, with actually the first application, which is to apply to, which is an application to the Swiss Personalized Oncology Project, the so-called BRAF pilot project, named from the name of the related gene. Right. And also in discussions with Basel and Zurich University hospitals to extend this deployment. So what does this do? So this is a kind of, let's say, zoom in view of a clinical site. So here's, for example, the, let's say, CHUV, right, the Lausanne University Hospital. There are here this is the EHR system, electronic health record. From this feeds the clinical data warehouse. And this is the non-connected zones. It's highly protected, it's non-connected to the internet. But from this, data are taken and are fed into the MEDCO database. And this database is then used as for interaction with other hospitals of the consortium in such a way that a researcher is able to generate queries. The query goes around without having the data to be transferred. Right? So it is the algorithm that goes to the data and not the other way around. And so this enables an exploration. So a cohort, as you know, is a set of patients that are studied, for example, for a given disease, say, for example, COVID-19, right? All the people who have diabetes and are afflicted by COVID-19 and are between, I don't know, 50 and 60 and happen to be female. So all of them can be gathered in based on a cohort exploration. For example, so how many individuals with this feature are there? I'm going to go to the data, and the data don't move, and the partial aggregates, so the results from the various sites, are homomorphically encrypted, which means that there is no information leakage when the data are then aggregated. Voilà, so one identifies those people, and then it is possible to aggregate the results and provide a breakdown by age, by gender, blah, blah, blah. Then comes, once the cohort has been identified, comes the MEDCO analysis, which means one does distributed analytics on the identified cohort. Again, the algorithms go to the data don't move, and again, the partial aggregates are homomorphically encrypted. Right? And then one can do, for example, what oncologists like to do is overall survival by a Kaplan-Meier computation, some computations on the data to predict, for example, the outcome when treated by given medicament, or linear regression, logistic regressions, or neural networks. So really machine learning stuff. Right? And then from this, it is possible to obtain curves such as this one, where you find here on the x-axis the time expressed in days, so the survival of the cohort, and this is a survival probability. And in this way, it is possible to see that those that are treated by the blue treatment actually fare better than the one that are treated by the red one, right? And so on. So it's a way to compare essentially the efficacy of different treatments. So then, talking about breaking the silos, as soon as one goes to a domain that is as regulated as health data, one has the privilege to talk with a number of highly talented lawyers and ethicists. In particular, we work a lot with Professor Effie Vallena from ETH and produced this report, Revolutionizing Medical Data Sharing Using Advanced Privacy Enhancing Technologies, that brings together authors from medicine, ethics, law, and computer science, the four of them. And the paper is online if you have appetite for this kind of literature. It's only 25 pages. Then we were approached, some colleagues in the US became aware, let's say, of this effort at the beginning of the pandemic and told us, oh, this is something that we should use also for COVID-19 purpose, because our initial focus was, as I mentioned, oncology. And so we have set up a consortium that brings together people from no less than 4 continents to work on this topic. But this is a more long-term effort. I'm not sure it will be a response to the second wave, but maybe it was for subsequent waves or for the next pandemic, be able to essentially make meaningful data sharing whenever needed at the appropriate scale. And then let me mention that actually this kind of tools are quite generic. For example, we are making use of these same tools, right? This is the kind of tools that I've described to share threat intelligence, right? It's completely outside of the medical field. It's not biomed. It's the fact that the various ministries of defense, including Switzerland, in this case, embodied by Arma Swiss, which is the research arm of the Swiss military. They sit actually on a database of cyber attacks information, right? And they know that other countries have similar information, but none of them is willing to transfer their own data, because this would, first of all, everyone is a bit embarrassed to have to admit that they get attacked, right? Although everyone is attacked, but mostly they are unwilling to share this data because this data may reveal some vulnerabilities, right? So again, same thing, the willingness to extract information without transferring the data, right? So this is online, you can find it as well with more description of this project. Let me conclude. So if you remember just one thing from this talk, the first bullet, it is possible to share data sets without transferring them, right? And this, I think, is going to be really something that will model the coming decade and will facilitate the success and adoption of machine learning in a meaningful way. Because in this way, there is no loss of control because the data are not transferred. There's higher motivation to share the data and a higher willingness to harmonize the data formats, which is a major issue for medical data, but also in a number of other areas, actually in almost all areas. Right? This means less paperwork and streamlining of the work of the ethics committees. We've seen the techniques. They are more difficult to pronounce than blockchain, so it's homomorphic encryption and secure multi-party computation, but expect to hear more about this. And if you're intrigued, just go to Wikipedia. There are nice explanations of what this is about. So we're deploying these solutions at the Swiss hospitals and beyond, which will lead to more efficient healthcare and better preparation for the next pandemic, right? Which also means better improved treatments and so on. Very good. With this, thank you very much for your attention, and we're looking forward for the questions.
Thank you very much, Jean-Pierre. We'll now start the panel discussion, but first, I have just a small digression. In fact, when preparing this panel, I looked for some data on our speakers and stumbled upon something interesting. On the internet. We just want to share that to you. So all of you are working on health data, and I was just wondering whether this is a precondition or a consequence. So that's just my question. Oh, wait, sorry. It seems I got from the Q&A, I was fooled by very well executed deepfake. Professor Hubaux has never had such glasses, in fact, indeed. So sorry about that. I will stop sharing this.
Yeah.
And so now
let's by the glasses.
Let's start with the discussion. First, I want to thank you for all of the speakers for these very understandable talks, and it's great also to see that there is such technology transfer from the academic world to real world solutions or things to support the usage of data. We have a few minutes left for the Q&A session. So there are quite a lot of interesting questions. Let me go back to the list. I lost that here. So maybe here. Maybe I will get one from one or two from the audience. There was one from Paul, let me just grab that. Yeah, there was one from Paul Olivier saying that given the current lack of hardware alternatives from Google, Apple, one could argue that decentralized public health actually equals corporatized public health. What do you think? What do you suggest to do to mediate this? Anybody wants to answer this question?
Sure. I can chip in. I think this question should be much broader, which means given that all computational infrastructure is currently powered by Google and Apple, whether it is decentralized or not, do we have any escape from them? And then we should take this question very seriously and think about which are the kind of research avenues as much as industrial avenues that get us out from this control. I don't think at all this is a question of decentralization. Decentralization does not need to rely on mobile phones, does not need to rely on things from Google and Apple. But what we have seen in the current times is that every time that any technology is out, because they have much higher capability to get faster to the market, they kind of get there. But this also happens in the centralized domain, right? When we see them having partnerships with many hospitals in the world to make predictions about data. So I think that this is also something that should go back to policy and about how much are we going to allow anymore to have these companies under control. And the other question is, and if then we cannot escape, there is a big difference between having all of these technologies that, yeah, we're going to have to live with this infrastructure. I hope we can get out of them, but at least don't give them the data, as compared to the technologies in which not only they have the platform, but also they have all the data with a kind of a wide bank.
Okay, thank you very much. I have also another question from Richard. That was, would the panelists agree that several Asian countries have been able to implement effective track and tracing, in particular backwards and upstreams, whereas Western countries are basically stuck in the Middle Ages and have to rely on mass containment measures, travel restriction, confinement, shutdown? Any idea on why and why do we have that? Maybe Marcel? Or...
Yeah, sure. Well, I'm not sure I would call it Middle Ages. I mean,
just quoting.
Look, I mean, from an epidemiological perspective, right? If it's, I mean, you know, it's not a game by any stretch, but you know, if you're playing a game, of course you want to have all the information that you could get your hands on, and so. Right, absent of any other constraint, any epidemiologist or anyone thinking about this issue would just tell you, why don't you give me an overview of every detail of the society so that I can handle this problem? But I think in many, you know, even non-epidemic situations, that would also be the case. And we've come, you know, generation after generation to the conclusion that this is not an appropriate way for us at least here and on this continent, to deal with problems, no matter what they are. And so I would say, you know, I wouldn't say that they've done anything better or worse. I think they've done it with the tools that they have, you know, at this position, and where they also have the corresponding setup to do that. And we have to use the tools and the corresponding cultural setup that we live, right? So it's not playing one against the other. And I think there, if you ask me, could we have done it better? For sure we could have, right? I mean, these are all the aspects that we talked about here in this session, where we could definitely have done things yet much better. But I don't think the answer would have been, oh, we should have gone all in on surveillance. That would have really solved the issue, because you can see that we're incapable of delivering COVID codes, right, in time. Like, do you really want that sort of authority to have a total overview over all in your every move? I mean, no, thank you, right? So I don't think that would have been a comparable situation. I don't think. I certainly think they handle it more efficiently, and that, I think, certainly in Switzerland we should take to our hearts, because we're the country, right, where people get upset when the train is 1 minute late. Like, we should not find ourselves in such a situation that we're so inefficient in dealing with the infrastructure that we have.
Thank you very much. I have also another, there was quite a lot of questions around the Swisscovig and personal data sharing. So there was also an interesting one on more on the social maybe side of it. Meg asked, what evidence is there that the Swisscovig app is being downloaded by those who are most marginalized? For example, migrants, asylum seekers, who may be the most vulnerable to the crowded living conditions. Anybody wants to answer this one?
That question is so on the spot, and the answer is so for no, we don't have the data. We built a tool in which we wouldn't collect these kind of things. We have to get them now through surveys. Getting surveys into place is not easy. As Marcel says, we cannot deliver COVID codes, let alone do a population-wide type of surveys. The surveys we have, they're very concentrated on the people that go and make their tests, and therefore they are already kind of only looking at that population. In particular, because those marginalized groups, many times they go to take tests for the same reasons as you suggest, they may not be installing the app. We don't get a vision on that, and we have written about the need to do these things, and I really hope that this can be done soon. But thank you very much for the question and for raising the issue. This issue needs to be raised more often.
Thank you very much. Marcel, you mentioned missing data, and I think it was interesting. I will first ask maybe Jean-Pierre, when we talked about, you talked about homomorphic encryption or other technologies. Could those type of technology be the way to get more information? Because in fact, you will not have access directly to the data, but you will have access only to what is interested for you.
Are you referring to tracing apps or medical data?
No, any type. I think Marcel was more talking about the epidemiology point of view, where he said, okay, to support the effort against pandemic, we need data, and it seems we don't have enough data for the moment. Yeah,
I mean, so this is there is a very powerful lesson in this, I think, in this pandemic, and I think the two other speakers have really referred to this, is that what we are observing, that in spite of the fact that the app in question has been developed with extreme caution from the point of view of the data protection, nevertheless, the population, much of the population says, oh no, this is not data protecting, right? So I refuse to download this app. So to me, this was a tremendous eye opener, because it means that much of the population maybe does not understand how much is at stake, right? People are making use of their cell phones, and as Carmela pointed out, they are making use of an infrastructure where all kinds, Marcel referred to this as well, right? All kinds of abuses are happening. And so the marginal risk brought by this app is absolutely microscopic in terms of data exposure, right? And at the same time, it is a response to the #1 priority worldwide, which is to get out of predicament, right? So this is really something that is absolutely remarkable. So it means that we need to explain much more to the population and to those who, agitate some risks here and there. To no, let's be careful. Let's see how much is at stake, right? Thousands of people can be killed. Tens of thousands or 100,000 people are losing their jobs, right? So we have to put things into proportions, right? And so that people realize that things are acceptable. There's another issue, of course, that people are very often are unwilling to know that they've been exposed because they're unwilling to quarantine. There's something that they may be ashamed to mention, but there's something that is very difficult to measure. Now, to come back directly to the question you raised, I do believe that there is an enormous potential of techniques that are called the PETs, the privacy enhancing technologies. This is typically the kind of things that Carmela and myself have been working on for years that are nowadays still vastly underutilized. And but things are changing because now the consciousness of the issues are increasing, and even companies such as Apple and Google are starting to make use of these techniques, the ones I've mentioned, but also differential privacy and other techniques. But what we've learned is that we need to make all the effort that is required to make sure that they are properly understood.
Thank you very much, Jean-Pierre. Maybe a broader question that we talked a lot of health data and we need to protect it. Do you have any example of a major health data hack and the consequences it had?
I mean, there are hacks against health data on a massive scale, right? So there's a website in the US that explains you for those cases of America. I shouldn't talk too much, but I mean, I can provide tons of evidence that this is happening.
It might be It might be interesting just to copy paste the link on the chat chat panel. Okay. Thank you. We've still 3 minutes left. Maybe there was also a question, and maybe it's not clear to everybody when we talk about cluster identification and the new app that is being developed. Any example of success of such an app elsewhere in the world, or such a way to have this cluster identification done automatically?
Automatically, I'm not sure. Through an app, I'm not aware, but I have to say I haven't gone completely down in the deep dive of the literature. I mean, there are certain approaches that have been taken that you could call automized or automated, but that did not include such a specific app. I mean, it included more general purpose apps and cross-referencing different databases. I mean, famously, I think the South Korean case and Taiwan, right, where then once you had an infected case, I mean, you cross-referenced where they were, with credit card usage and so on. I mean, of course, that you can call that automated, and that would then probably be a success on the epidemiological basis. But that's obviously not how anyone thinks about it here. So the way we propose it here, I think would be the first time that we would really see this happening on such a scale, if it's going to happen.
Okay, thank you very much, Marcel. I'm sorry we've had a lot of really interesting questions, but we're just running behind time, and we will stop here. As you mentioned, Marcel, we're in Switzerland, so right in time, leaving 1 minute to Michael to close this session. Once again, thank you very much for the discussion, your presentation, and the Q&A session afterwards. Thank you.
Thank you, Olivier, and thank you to Marcel, Carmela, and Jean-Pierre for an excellent discussion on such an important and topical issue. My takeaway is to repeat what Jean-Pierre said, that clearly there's a lack of digital trust, and technology is one key solution to make sure that trust can be ensured. But ultimately, data governance to create digital trust has to be broader. It's necessary to have privacy by design, but it's also important to consider to have governments weigh in on data governance, to have companies develop good tools, as Google and Apple were working on these tools, and also civil society has a role, and that's going to be what we're going to be discussing in the afternoon, is the broader environment for creating digital trust. And that will start after lunch at 1:30. So thank you again, everyone, for attending, and we will look forward to seeing you at 1:30. Bon appetit.